Welcome to this fourth week of this MOOC course, Psychiatry and Overview. This week we will try and understand what is called a child mental health or child and adolescent psychiatry or adolescent psychiatry. Why is child psychiatry so important? In one way, yes, and in some way, no. Because normally what is understood that children are the future of the country and they should be happy and playing and all. On the other hand, there is always the issue of children being unruly and not obeying, and there is a whole list of problems which parents and teachers can mention, and they are always complaining against the kids complaining. So, there is a lot of misery around childhood as much as there is happiness around it. So, the basic question before addressing child and adolescent mental issues or psychiatry is one simple question: is there a problem child? Now, for a time being, let us look at the data which is available from epidemiological studies and from clinics all across the world. To answer this question from a perspective of a clinician and a mental health professional, the data suggests that there is a high prevalence of mental health problems, almost 10 to 20% in a population. Half of the cases of mental illness which are now recognized, they begin by age 14 and 3/4 by age 24. The median number of years from the time child first experiences psychiatric disturbance and receives treatment is 9 years. That means, when the child actually starts having a problem and by the time he comes to the doctor, 9 years have elapsed. The long delays, there is inadequate care, and so if you look at the type of illnesses which kids have and adolescents, 17% have depression, anxiety disorder, almost 13% of children and adolescents, which is a high number by all standards, even if you compare it with adults. ADHD, which is a very common diagnosis right from childhood ADHD to adult ADHD, 3 to 7%. Bipolar mood disorder, we have talked about bipolar in adults in the last week, and learning disabilities. One child in every classroom has what we call learning disability. We learn about this as we go on into the other talks, and autism 1 in 89. So, this is the epidemiology. The issues really have to decide about problems in with children and adolescent is obviously we have seen the epidemiology, which gives you a rough data of how much, what percentage of population out of all the children and adolescents is inflicted by behavioral issues or mental illnesses. Etiology we will discuss about it. Neurobiology and clinical research indicates that there are certain set of illnesses, but it also indicates that most kids who have problems may not be ill, they may be just behavioral issues. So, the biggest question which remains to decide for any clinician or for anybody who, even if you are in a teaching profession or even if you are running an NGO or if you are working with kids in whatever capacity, kids who have problems, we have to decide whether it is a symptom of some underlying issue or it is just a transitory behavioral issue which may be taken as a symptom and allowed to be passed off, or it is a syndromal diagnosis. Whether we have to label the kids or we have to take a developmental perspective. When I am saying developmental perspective, it simply means that as we have talked about the brain growth in the, if you remember from the first week, that the brain grows in response to the environment. The neurons, the 10 to the power 10 or 11 number of neurons which are in a network, they form a network in response to the environmental stimuli. And during development there are a lot of events, lot of behavior, lot of aberrations happen which are not temporary. And if you look at it at your own life or anybody who is an adult, that lot of things which we talk about kids, that they are not obedient, they are defiant, or they are lacking in concentration or not focused, and so on. The whole list of barrage of complaints against children, we all have been like this at some point of the time in our life. Some of them aberrations may have continued with us, some of them passed off, and it happens to everybody, because that is probably how the brain develops, by taking in input and by responding. And in the response, there are no robo-like responses of human beings. Each human being has its, even with the same type of environment, and you can see it with, as if you remember when we were talking about genetics in monozygotic twins, even with the same environment and the same set of genes, there is never a 100% concordance of any behavior. Forget the illness. No two individuals, even if they are monozygotic twins, do everything in the same way. There may be high concordance for some things, there may be high concordance for low concordance for the other thing. So, the same environment, the same stimuli, the same set of information which goes from the environment and the nurture to the kid is processed differently, and a different set of behavior may be brought out. To give an example, even if you take something as disruptive as anger, and you can see it around you, because obviously no psychiatry or mental health or neurosciences does not work in isolation, it has to be rooted in the world. The simplest thing as anger, no two people show their anger in the same way. So, now situation may be the same, but the output is different, and that is the developmental perspective. So, vis-a-vis developmental perspective, vis-a-vis labeling a behavior, because labeling is something which is easy to do. You can read certain criteria, put a label that the child is this or that, but that cannot be done in a hurry, because once you label, normally these labels stick to the person. And if you remember that 5 axis which I talked about when talking about DSM, the axis 2 is about developmental disorders. So, once you say that there is a developmental disorder or a label that as an illness, it normally sticks. So, one should be very careful. Who are the people who help children? Psychiatrists, they are specialized in child psychiatry, but they are in short supply. So are clinical psychologists, special educators, which you find in most of the metros in India at least now, people who work with kids with dyslexia and dysgraphia, occupational therapists, speech therapists, and not the least, parents. One can ignore the attendant and caretakers when talking about the adult psychiatry illnesses, but not in the case of parents. School teachers. School is the place where most of the problems are noticed. School is the place from where most of the kids are being referred to us. So, what is development? If you take few of these theories which we mentioned while talking about psychology, psychoanalytic, psychosocial, cognitive, behavioral, they all have mentioned different stages of development, which some of them are valid, some of them were valid at the time they were proposed, they have been counterposed. But the fact of the matter is that all human minds undergo in a normal circumstances a similar process of development. What are the issues in development? You look at whether it is a normal development vis-a-vis abnormal. Is there an issue which is presenting when we are talking about kids, or is there a problem? Not performing in a school in one exam may be an issue, and the child may not have been well, or there may have been an emotional problem. So, a dip in the scores in one exam is an issue, but a child who is consistently not performing over 1 or 2, 3 classes may be a problem. It is a state versus trait. A state is temporary, a trait is more or less permanent. So, a child who is having a fever and is irritable, but otherwise not irritable, is a state. Compare it with a child who is always irritable for a very, very prolonged period. And as I said, it is a developmental step or aberration. Like lot of teenagers, they start rebelling against their parents and started getting angry over things. They do not like being told everything, and they do not like being directed on every small issue, which is a developmental step. But if for a adolescent, this disciplining or set of instructions from the parents becomes such an issue that the child does not eat for many days or gets angry or puts things at fire, breaks things, then it may be an aberration. Again, the debate of nature versus nurture, genetics and epigenetics, we have mentioned about this in previous lectures. So, just to reiterate, this whole debate of whether the person is born with a personality or the person is a blank slate over something can be written has been raging from ages, but now it is getting more or less settled that it is both. A person is born with a certain genetic template and temperament. Temperament is basically, if you look at certain behavioral paradigms like attention span, like reaction to stress, like predominant mood state, activity level. So, there are certain 8 or 9 parameters on which you have to assess the temperament. People are born with temperament. This temperament remains like a genetic blueprint over which the nurture modulates, and that is how we become adults. We all, it is a scientific thing, but if you look deeply into yourself, you will really find what is happening. So, it is a genetics and epigenetics. So, genes have this template which can be modified by the environment, right from the biochemical environment in the womb to the external upbringing things in the initial few years, when the brain tissues, the brain neurons are really forming that network. Because once this, because of the trauma, toxins and lack of a secure, healthy environment, this network itself can be altered in an aberrant form. So, normally it may sound that Freud was right, that all your adulthood behavior has really been programmed in the sense of synapses and the network, because if these anxieties which get into the mind and the brain gets into the firing an aberrant pattern, these anxieties always remain. If you just look around yourself and see people, there are a lot of people who will tell you, okay, I get fearful to this, or I cannot take criticism. These are all things which everybody suffers. Everybody is afraid of heights, everybody is afraid of something or the other, but most people who have a secure environment, they grow out. For some people where it is not so, their brain learns to respond in a different way, in the form of anxiety or panic attack. For the same situation, somebody may be very cool, somebody may not be. So, if now illnesses can happen in adulthood, but if you look at the behavioral patterns, they are more or less people learn as they grow till around 16, 17, 18 years of age. So, this developmental trajectory, so this is how it actually the child develops. As I said, your brain is growing, you come into the world, there is an environment around you which keeps you, makes you more trusting, comfortable, harmonious. That sustained trust and security is very important for the brain, and it is amply proven now. And then the developmental trajectory, we have talked about the brain, that how it overgrows and it prunes, how it reflects into the behavior, that there are critical periods while developing from say 0 month to say about 18 years, so slightly beyond that also, where there are critical periods when the environment challenges you. One of such periods is adolescent, when there are hormonal changes happening in the body, and so on and so forth, where one responds to that, and in the process learns skills, learns ways to handle, and his own temperament is modulated. But if you just look across the people and the number of people whom you know, the growth is always differential within the individual and between individuals. No two individuals, as I was saying, grow alike in the same situation. That means the brain itself, because of genetics or because of individual differences, is responding in a different way and forming different network, and hence a different output of the behavior. But within the individual also, there is a hell lot of difference in between your skills, your way. Somebody may be good in talking, somebody may be good in expressing the mind in a different way, somebody may not be so comfortable expressing. If you observe your own mind, which is obviously the best laboratory to observe, if you just peep into your head and just look at the way your mind responds to different situations, you will find that it is probably what the way you were 10 years back, you are not now. Maybe when you were growing, you were doing things differently. Even at that time, you were not adept at all skills, and everything was not growing together. So, this differential growth, it really keeps the whole flavor of life alive. But we have to keep this in mind when we are talking about kids and their problem. So, what is a problem? There is a pattern of behavior, cognition, which is thinking, judgment, attention, emotional or physical symptoms shown by a individual. The characteristic must include distress, disability, risk of further suffering. So, in kids, you have to look at the pattern of behavior. A single behavior may be very severe to disrupt things, but it may not be very significant. But when you talk about a pattern of behavior, so there should be a significant distress by it, or there should be a disability which is arising out of behavior, or risk of further suffering or harm. So, what are the risk factors which kids have? Let us talk about the environment: poverty, inconsistent caregiving, parental mental illness, death of a parent, homelessness, family breakup, early pregnancy, neonatal complications, etc. These, if you look at these factors, these are stressful for anybody. But if you are a stable, healthy individual, you can suffer all this and still move on. But for kids who are growing, these things they pose a significant risk. Oppose resilience to risk. As I said, this is a variable that increases one's ability to avoid negative outcomes despite a risk for psychopathology. That means, if your brain is programmed such that within your own mind, within your own brain processes, the brain is able to absorb these external stresses in a way that it does not lead to negative outcomes in your behavior or thinking process. That is resilience. So, brain has both. It has resilience factors, it has inner capability to absorb the shocks and still grow on. See, the surprise is that a lot of people have lot of negative factors when they are being brought up, but in spite of that, most kids turn out to be normal. So, the same amount of stress does not destroy everybody, but there is a small percentage which as we said 10 to 20% of all kids have mental illnesses of some sort. Not all of them are related to stress, but some of them, especially the behavioral issues, even if there is a illness, the external environment can complicate it. Like imagine a kid who has a predisposition to having anger outburst. Such kid is born and brought up in a family where the father drinks and comes and beats up the mother. This has a huge negative impact, and it may actually make him more angry, which he can express in school or out on the road, and then he will be labeled as a sick person without, unless somebody goes and really looks back into the cause of it. So, a much more difficult factor to categorize, and it may change over time depending on the child and environment. So, we cannot really rule out environment when we are talking about children. Individual, family and social factors will all have an impact. So, how do we know when there is a problem? or how do we know when a problem demands treatment? This is the trick of good child psychiatry or child mental health. And so, child psychiatry does not remain in the purview of psychiatrists itself as adult psychiatry can, because there are a lot of agencies involved, parents are involved, school is involved, psychologists are involved, occupational therapists, and a lot of adults and everybody in the family who, especially in a country like India, where a child is always in the eye of some uncle, auntie and big brothers and all. So, before we really go to the talking about illnesses in the subsequent lecture, I will like to take you to a different dimension altogether. This is what I was talking about children. When you really look at them, and when you look at the children and say whether they have a problem, or we are really talking about whether they have a illness. Before we really come to that, I would like to touch briefly upon what is a very common term called generational conflict. Now, this I will tell you as an example of what I was talking, whether there is a problem, whether there is an issue, or there is an illness, or all these conflicts really come to a peak at the time of teenagers, when you are talking about adolescents. And there is this word which I have put it here called generational conflict. If you just look at this thing, this is a very common, all generations have heard it. It is something which has remained always. Every generation will say that the kids are spoiled, they do not listen, the kids will say the parents do not understand. Now, we are making some sense of it. And what is the real turbulence? This starts around 10, 12 years of age, continues till 18 and in some cases. So, the big question is whether it is hardwired. Hardwired means whether your brain actually is like this. So, when somebody said that adolescence is nothing but a teetering bulbs of dread and dreams, there is a lot of anxiety in, you go back to your adolescent, and if you are an adolescent you can still think being there, that all the time your mind is in a perpetual anxiety of what is happening, who are you. Now, these are the questions which human beings always ask, but as they grow old, when their chances become less of changing life, and when the life is more or less settled, they ask it less. Now, some people can remain teenagers and anxious adults all their life, but in adolescent you keep asking this. There is a sudden dread, but at the same time, to counter this dread are dreams. As I was saying, there is a risk, there is a dread, and there is a resilience also. This resilience also is giving you dreaming. So, what are we? Are we just gooey lumps encased in hard protective shells, which is brain? This is brain. This is mounted atop mobile pedestal, which are your legs that roam the world on pairs of fuzzy jointed stilts. These are your joints. So, are we just this gooey lump body which is encased in some shell, and or are we something more? But one thing we are sure, that life evolves amidst the conflicts of opposite. Imagine the number of conflicts, the good, bad, day, night, right, wrong, white, black, everything. There is nothing which is existing single in the world. And the universal conflict of generations. But I guess that this conflict, while you are growing, and this conflict which actually pushes you and puts you in a sort of a real tension, this actually helps you evolve the mind and the thought. What I will do is, after this, I will talk briefly about adolescents in the next lecture, and then we will go on to talk about some illnesses and some behavioral issues. So, rest about the adolescents in the next lecture. Thank you.